Hey, Social Security recipients, there's significant news that could drastically impact your financial situation overnight. Congress has officially approved a one-time $3,200 direct payment for Social Security and SSDI beneficiaries, signaling relief that may soon be deposited into your account. For millions of Americans who rely on every dollar from their benefits, this development could not have come at a more crucial moment, especially given the ongoing economic challenges and relentless inflation disproportionately affecting those on fixed incomes. After months of deliberation, advocacy, and negotiation in Washington, lawmakers passed legislation authorizing this substantial payment as part of a broader economic relief package designed to provide immediate assistance to individuals and households struggling to keep up with rising costs. This action acknowledges long-standing concerns that recent cost of living adjustments, though well-intentioned, have fallen short of covering the actual increases in essential expenses like food, housing, utilities, transportation, and especially medical care. Many beneficiaries have voiced frustration about watching their budgets tighten year after year, even as official inflation numbers fail to reflect the true rise in costs for necessities they can't avoid. The $3,200 figure wasn't randomly selected. Rather, it represents an amount calculated by leading advocacy groups who analyze the cumulative shortfall between what beneficiaries have received through past COLAs and what they should have received if those adjustments had kept pace with real inflation, particularly in categories heavily weighted toward older adults and people with disabilities. These groups have long argued that the consumer price index used to determine COLAs underestimates inflation in healthcare, prescription drugs, specialized services, and other expenditures seniors and disabled Americans face, often leaving them stretched thinner each year despite adjustments meant to preserve purchasing power. Many recipients report that just in the last 2 years, their prescription costs alone have risen by double-digit percentages, adding hundreds or even thousands of dollars annually to their expenses without corresponding increases in income to cover them. Under the legislation's terms, the Social Security Administration has been instructed to begin processing these payments within 30 days of the bill's enactment using the same payment method beneficiaries currently use to receive their regular monthly benefits, whether direct deposit or paper check. The rollout will be staggered, following a phased distribution plan modeled after the stimulus payments distributed during the COVID-19 pandemic, starting with recipients at the lowest income levels before expanding to include higher income beneficiaries, with the entire process expected to be completed within 90 days. This phased approach is intended to ensure that those most in need receive their funds as early as possible, providing urgent relief to households where every dollar counts toward essentials. Additionally, to promote transparency and accountability, the legislation mandates that the Social Security Administration provide weekly public updates on the progress of these distributions, enabling beneficiaries to track the rollout and estimate when their payment might arrive based on their circumstances. This transparency measure was included in response to past criticism over the lack of communication regarding benefit changes, aiming to build trust and reduce confusion or misinformation during the process. It's important to note that not every Social Security or SSDI recipient will automatically receive the full $3,200. Eligibility requirements apply, including the stipulation that recipients must have been receiving benefits before January 1st of the current year. Income thresholds also affect the payment amount. For individuals with adjusted gross incomes above $75,000, and for couples filing jointly with incomes above $150,000, the payment will gradually phase out, decreasing incrementally for every $1,000 earned above those thresholds until it phases out completely for the highest income recipients. Beneficiaries are encouraged to review their most recent tax filings to understand where they fall within these thresholds and determine whether they will receive the full amount or a reduced payment based on their reported income. A critical safeguard included in the legislation ensures that this payment will not be counted as income for determining eligibility for other assistance programs such as Medicaid, SNAP benefits, or subsidized housing, preserving beneficiaries' access to these vital supports even after receiving the additional funds. Furthermore, protections were enacted to shield this payment from garnishment by most creditors, with limited exceptions for certain debts like child support arrears, ensuring that the funds are directed to help beneficiaries rather than being seized by third parties. Beneficiaries will not need to take any action to claim this payment. It will be processed automatically based on the information already on file with the Social Security Administration, requiring no applications, additional forms, or direct communication with the agency to secure eligibility. Another key provision addresses tax treatment. This $3,200 payment will not be considered taxable income at the federal level, following the same precedent set by previous economic impact payments, though recipients are advised to check with a tax professional to confirm whether any state-level tax implications may apply based on their jurisdiction. Supplemental Security Income (SSI) recipients are explicitly included in the eligibility scope, ensuring that individuals relying on SSI alone or in combination with other Social Security benefits will also receive the payment, addressing fears that this vulnerable population might be overlooked in relief efforts. The legislation also includes special instructions for representative payees, individuals appointed to manage benefits on behalf of another person, clarifying that these payees will receive the payment just as they do regular monthly benefits, with the obligation to use the funds solely in the beneficiary's best interest. The Social Security Administration plans to issue further guidance tailored to representative payees in the coming weeks to ensure clarity and compliance. Importantly, recipients of Social Security survivor benefits and dependent benefits are also included in the payment distribution, though some adjustments may apply to align with their specific benefit categories. For individuals who applied for benefits before January 1st but are still awaiting approval due to administrative backlogs, the legislation guarantees retroactive eligibility, acknowledging the delays that many applicants experience and ensuring they will not be excluded from this financial support. Given the scope of this payment, officials have raised concerns about the potential for scams targeting beneficiaries. Unfortunately, past instances have shown that fraudsters often exploit major benefits announcements to prey on vulnerable individuals. Beneficiaries are reminded that the Social Security Administration will never call, email, or text requesting personal information to process this payment. They already have the necessary data and will never ask for Social Security numbers, bank account details, or payment in exchange for releasing funds. Any such contact is fraudulent and should be reported to the agency's dedicated fraud hotline to protect yourself and others from falling victim to scams. For many beneficiaries, this one-time payment comes as a lifeline during a period of rising living costs, with recent surveys showing that over 60% of Social Security recipients rely on their benefits for at least half of their household income, and about one-third depending on benefits for nearly all of their income. This additional $3,200 could offer crucial breathing room for tight budgets stretched by inflation, unexpected medical bills, or other urgent needs. Some policy experts view this legislation as a positive step toward broader reforms, while others argue it serves merely as a temporary measure that does not address systemic underfunding or the long-term solvency challenges facing Social Security. An important provision included in the bill mandates that the Social Security Administration conduct a comprehensive study on the adequacy of current benefit levels relative to the real-world expenses faced by beneficiaries, with findings due to Congress within 1 year. This study could lay the groundwork for future reforms or adjustments that better reflect the actual economic pressures faced by older adults and disabled individuals in today's economy. As the rollout begins, many beneficiaries are already planning how they will allocate these additional funds to cover overdue expenses, medical treatments, utility bills, or much-needed repairs and essentials they've delayed purchasing. Others are raising questions about whether future relief measures will follow, or if this payment signals a one-time intervention rather than the beginning of more permanent adjustments. The future of Social Security policy remains a subject of debate among lawmakers, economists, and advocacy organizations. But this payment reflects a growing recognition of the urgent financial challenges facing those who depend on Social Security and SSDI benefits. For now, the upcoming payment provides a measure of immediate relief and sparks broader discussions about ensuring benefit levels keep pace with actual living costs in the years ahead.